So, of course, health interventions obviously can help improve health, but the benefits often go beyond the patient. They can increase productivity and therefore have spillover effects on the economy. So, interventions that have a positive clinical value or additional therapeutic value are always something that we should make sure that patients have access to. However, not all medicines bring in additional therapeutic value. And that's why we have to make sure that patients get what they need and that the system doesn't pay for things that do not bring in additional therapeutic value, or they do not pay more for things that do not bring in additional therapeutic value. So HTA, health technology assessment, is what we need in order to make sure that we have a sustainable system and that the patients get what they need and the taxpayers' money is put to good use. So assessing which drugs actually bring in the value for the patients. At the same time, you also need to make other interventions. You have to, apart from the supply side, you also have to address the demand side. There are some therapeutic areas where there might be overprescribing, which is bad for patients. They shouldn't take drugs that they don't need, but also bad for the system as it costs money. Other inefficiencies do exist, and there are several. For example, therapeutic substitution. By coincidence, since we're at an Economist event today, a paper that I wrote on therapeutic substitution some time ago was picked up by the Economist that wrote an article on it, and it highlights how therapeutic substitution can sometimes lead to inefficiencies without creating necessarily any additional therapeutic value to all patients involved. Now, apart from that, if we want a sustainable health system, solutions do lie within the pharmaceutical system, within the healthcare system, but also there are some solutions that lie outside, and we have to address these. I mean, we are facing many challenges, including aging population, including climate change, the lifestyle, the diseases related to lifestyle and so on, and therefore we need smart solutions. We need to take advantage of AI and digital technologies to address any inefficiencies, to improve productivity, because we're also facing a severe labor force shortage in healthcare globally. And of course, we need to take advantage of data and statistics available to make the right predictions about what our needs will be in the future and how we can respond to all these. And of course, behavioral nudges, behavioral interventions, extremely important for the healthcare system, and we need to act on that in order to also improve the lifestyles that lead to improved health. Now, when it comes to Greece and creating an innovative environment, or an environment that can attract R&D as a hub, well, let's start with clinical trials. What do clinical trials need? They need speed, they need fast approvals, they need to cut red tape. You need, of course, the tight collaboration and good collaboration between universities, academia, industry, and the government. And you need, of course, the space and the infrastructure. Now, several of these have been addressed already, I understand, in new regulations that will be implemented soon. So it's vital that these are that these translate to practice soon. But I think Greece could be bold and optimistic and strive for more. I mean, why limit this to clinical trials? You can go way beyond. I mean, clinical trials already, while there is an increase in approvals in Greece, a lot of them are shifting towards China and the US, right? China used to have 6% of the global clinical trials 10 years ago, and now they have a third of the global market. So it's a challenging environment, and Greece can also look beyond that to innovation more generally. So why not also think about preclinical research, preclinical R&D? I know it's a bold move, but you have to look at the strengths and the weaknesses of Greece and act on that. What are the weaknesses to address them? What are the strengths to capitalize? According to Eurostat data, there's been a massive increase in R&D investment in Greece over the past decade. The country is still below the EU average, but there has been a massive increase. If you look at the mix, this is largely driven by government spending on R&D. So what's lacking is the business investment in R&D, and we need to understand what are the obstacles. So looking at the Global Innovation Index, where does Greece seem to be doing well? They seem to be doing well in human capital and on research, but they seem to be lagging behind in institutions, which is really important, on business sophistication and market sophistication. So these are areas where you need to act on in order to attract the venture capital that you need, all the funding that you need in order to create this environment. And finally, and I'm just finishing off, Greece is home to a lot of manufacturing, pharmaceutical manufacturing, many plants that supply and also export. So such an innovation hub, such an area where R&D would be locally, could blend in with the manufacturing capacity.